You're listening to the Foreign and International Medical Graduate Show, a podcast to inspire physicians in the process of immigration to the United States and access to graduate medical education. We create meaningful and helpful content that motivates medical students and doctors throughout the world, with the goal of creating a community that supports itself and gives feedback to each other, that stays updated with the most recent tips and advice on how to make it in America and become a successful resident or fellow in the speciality of your dreams. Dr. Alonso Osorio is board certified and residency trained in both emergency and family medicine and will be bringing you 20 years of his personal experiences, struggles, and motivation. We'll be chatting with people like you to talk about the lessons they've learned along their personal path, how to make an impact, and how we can all benefit from it. Also, we'll analyse the current resources available and how to benefit from them. Thanks for joining us. Please enjoy the show.
Hello and welcome to episode number 18. Today, the Foreign and International Medical Graduate Podcast will be featuring Dr. Santiago Lopez. Santiago Lopez is a fellow emergency medicine physician. He's currently a resident, a doctor in the state of New York, who has a fantastic, phenomenal story to tell us. We connected through the internet and we exchanged some messages, and I felt that his introduction and his history seems to be rather motivating, and he's unique on the fact that there is some struggles that he had to go through to make it in America as a successful physician. Right now, Dr. Santiago Lopez is doing his emergency medicine residency training at Good Samaritan Hospital Medical Center, and he is what we call a PGY-1. PGY means postgraduate year number 1 out of 3, correct? You're in a 3 or a 4-year path?
I'm in a 4-year program, yeah.
So he's emergency medicine has 2 types of paths. Either a combined residency program of emergency medicine, internal medicine, emergency medicine, family medicine that lasts 5 years, emergency medicine, pediatrics, 5 years, or you have individual programs that are 4 years. Very few of them, I would say probably only like 25% or less of the programs across the United States. And there is also the 3-year categorical programs in emergency medicine, in which that was the case for me. He's currently in New York. And I want to make everybody aware that right now we have reached 2,400 downloads. I really want to thank you for your participation and involvement on the podcast. And as of this week, the YouTube channel is live. My first episode has gone live, the pilot episode, and I find it remarkably motivating. We have more than 300 views in less than 48 hours, and I'm hoping to get some useful content for you guys as well to connect this podcast towards that and just to make this podcast to have more awareness across the internet. So, Dr. Santiago Lopez, welcome to the show. Thank you for being here, taking time off your few hours off before you go into your shift. And I do know that you went for medical education at the UAG, what we call the Universidad Autónoma de Guadalajara in Mexico. And you've just completed your training in May 2019. And you went to undergraduate medical education in Iowa State University of Science and Technology in Ames, Iowa, where he completed an undergrad degree on biology. He has a fantastic story to tell us. Dr. Lopez, could you tell us a little bit more about you and how you were able to succeed this far?
Hi, thank you. First of all, I want to thank you for having me. I saw your posts on the internet, and I think this is a great pod. Some more difficulty and more difficult process compared to other people. So I think this is a great platform. So thank you for having me. Now, with that being said, so long story short, I was born and raised in Chicago. Both my parents came to this country in the 80s. They left everything behind, and their point of coming to this country was, I'm sure like most people coming to this country, was for their kids to have a better life. My mom and dad literally left everything behind. We lived in a humble home. We didn't have much, but they did what they could. They always made sure we had food on a table and a roof for our house, and I'll always be thankful for that. But with that being said, I had to make something of myself. I couldn't let them just come to this country and not do something for them. So we lived in Chicago. It wasn't a bad neighborhood, but it wasn't the greatest. I saw people get shot and died in front of me a couple times. So like that was the kind of neighborhood we lived in. And my parents didn't want us to be raised in that neighborhood. So they just worked harder, and they got enough money to help us move to another neighborhood called Skokie. So I did middle school and high school in Skokie, Illinois. From there, like how you said, I was the first person in my family to go to college. And I attended Iowa State University in Ames, Iowa, how you said. I got a bachelor's degree again, the first person to graduate from there. So it's something that my family looks up to, and I try to pay everything back. I know that I just have to do what I can to make sure I fulfill their dreams as well as mine. And maybe I didn't always get the best scores in high school or in college. I wasn't a valedictorian. I didn't have like a perfect GPA. I didn't have the perfect MCAT score. A bunch of these students, they think that they need the perfect MCAT score, the perfect GPA, and I wasn't necessarily that student. People learn differently. I didn't learn necessarily the perfect way. I didn't learn how to study in undergrad, but what I did have was perseverance. And it was brought up to me that UAG was a medical school in Mexico. I had never heard of it. Once every door closed on me in the United States with my scores and my MCAT, I thought my life was over, but UAG opened their doors to me, and I'll always be thankful for them. They allowed me to go to Mexico. It used to be a 5-year program. Now it's a 4-year program, the traditional 4 years. They had the 5th-year pathway. But the first 2 years are in Mexico, and the 3rd and 4th year are in the States doing your clinical rotations. And then we can go on from there. I think that's a generalized introduction, I guess, of my life and how I'm here now.
Cool. Who was the fundamental person in your life to motivate you to become a doctor? Or was there anyone that ever encouraged you to become a physician? Or who were you looking up to that really kind of planted that seed in your spirit to move on from there?
Yeah, great question. My family, there was no one really at the time who has been in anything of medicine. Both my parents were like machinists and factory workers for the most part. So we didn't have any recognition of medicine. I just knew that I wanted to help people from a young age. I thought for a while of going into the military because I just wanted to help people. And then from there on, I kind of deviated more into the schooling and in that way. But the aspect of just helping and saving lives, I think that was the most driving force for me. Not necessarily someone planting a seed, if that makes sense. Because I didn't have that with me. Our family was very humble. We didn't have anything. We didn't know anything about medicine. So I had to figure out all these things along the way.
How do your parents feel? How proud do they feel of you specifically having accomplished so much this far at such a young age?
I mean, from what they tell me, I'm sure they say they're very proud of not just myself, but my sister and I. My sister is a nurse down in Texas. They're both very proud of us and what we've accomplished. And I think the thing that they're most proud of, especially my dad, he just won't mention it. He's one of those old school kind of guys. For him, hearing his stories and how he came into this country and the struggles that he had to suffer coming over, for him, all he ever told me growing up, he's like, just work and study so you don't have to come home looking like me and my hands all cut up so you can have a better life. From what they tell me, I mean, my mom is more vocal about it, but I can feel it that they're very proud of who I am. And I'm very proud of what I have accomplished for them and for myself and for other people who have similar stories.
Since you say that, I don't want to become political, but I know that we Latinos sometimes are categorized by political figures in this country of being bad people, that we just come to this country to take advantage of the system and to just drain stuff from them and take on jobs that no one else, that the Americans want to do. To be honest with you, our hopes and expectations, like mine, like Dr. Santiago's, was to come to this country to make someone of yourself. And, you have choices, you have the path, you make whatever you want to make of yourself. And this is the beautiful thing about America, that I think, Santiago, and if you agree with me, if you work hard, you dedicate yourself, you're able to succeed.
Yeah, 100%. Absolutely. I couldn't agree with you more. It's very easy, not just for people from outside of the country coming in or anyone from anywhere. It's very easy to deviate yourself. My mom always told me, and she always told me a saying, she's like, if the tree starts bending from the roots, it's always going to be bent. So it's very important that you have good roots and a good foundation. And you have people looking out for you and trying to direct you in the right way. It doesn't matter to me where you're from in the country. You could be from anywhere. But if you have good intentions and you have a motivation to succeed and that's what you really set your mind to, it's absolutely possible. There's hundreds of people like you and I who have done it, maybe not as vocal, but this is a great platform again for us to come out. I have never heard of this type of IMG, FMG, so I think this is wonderful. But yes, absolutely. We come to this country. Luckily, I was born here in this country. At least it gives us the opportunity to be something of ourselves.
Awesome. And I can tell you're bilingual because initially our introduction, the preparation for the show, we were exchanging words in Spanish, and I think you're remarkably fluent, and that's going to help you significantly in your professional career. So the question goes, How was your father and your mother? How were they about the languages spoken in the household? And did they ever mention how important and significant was to have a second language always available for you for interaction with people? And how, I don't know if they ever mentioned it to you, if it was going to help you most likely in the future professionally.
Yeah, absolutely. My parents, again, all they ever did was trying to make a better life for my sister and I. So they really were hammering us on being bilingual from the beginning. At home, even now, all we speak at home is Spanish with not just my parents, but all my rest of my family members, my grandparents. We all speak Spanish at home. English, I learned a little bit from my sister that was a little bit older than I am. And then at school, mostly is where I learned English. But it was still a young age. I started English in kindergarten. So I started picking it up. But at home, all we spoke was Spanish. And exactly your point. They knew exactly what the power of being able to speak fluently in two languages. And they knew in the long run, they were like, this country's you're going to have to know more than just English. English is not going to be enough. So I'm thankful for that every day.
I can assure you a significant advantage for you professional, as you can have been told by now that everybody's probably calling you, hey, Dr. Santiago, can you see this patient? Can you see that patient? Can you translate for me? Or the way they do it to me, they send me all my Latino customers, my patients into my area, and I have 17 beds of Spanish-speaking people,
Absolutely. And then speaking on behalf of that, and in emergency medicine, it's even more helpful because we have these iPads and these phones that help translate, but how often are you going to have time to do that in a trauma or in a rapid response? Sometimes these patients, especially here in New York, I'm sure it's the same down in Florida, a lot of our population here doesn't speak English. And if they do, it's like very minimal amounts. So when they do come in, let's say after an MBC and it's a trauma and you need to get some information, let's say they're in oral anticoagulants, you need to know what's going on. And sometimes they're like, where's Santi? Like, let's get him in here. And it helps. It speeds up everything.
And if you agree with me, the translation by the computer, if you get the chance to do that, doesn't really put the passions of the wording or the environment of the circumstances of what the patient wants to really express to you. Because Spanish is a very emotional, culturally loaded, spiritually loaded language that the message that they're trying to communicate is, if it's not well perceived in the right environment and with the right circumstances, might not be understood very well what the patient is trying to express. So one thing that I have seen is that my patients, when they see that I'm Latino, Colombian, and they can connect to you, like their eyes lighten up and they feel that there's someone finally that is going to be able to understand them.
Absolutely. And you're 100% correct. I couldn't even say that any better. When a patient hears, they feel happy and relieved that there's at least a translator or a computer or something that helps translate for them, because at least they can express it out. But when I come to them and I'm like, bueno, soy Dr. Lopez, ¿cómo está? ¿Qué lo que viene hoy? ¿Por qué esto? Y lo que sea. They just get how you said, your eyes just brighten up and they feel like they're saved. They feel like finally something's going to happen. And another thing that I learned too was going to medical school in Mexico. It didn't just allow me to just perfect my Spanish. Culture completely different, which is just because you speak Spanish doesn't necessarily mean you understand the person. And I'm sure if you're Colombian, I'm sure your Spanish and your words and your accent's completely different. Sometimes words might not mean the same, but it allows you to feel something for the patient and they understand it. And, it just makes them feel a lot better. And at the end of the day, we're here for our patients. We're here to do what is best for them. So if that can help them, and it goes a long way, absolutely.
Santiago, a little earlier, you said something that really kind of moved me and gave me goosebumps. You said that despite the fact that you were not the top 95th percentile, 99th percentile student in high school, in undergrad, and that despite the fact that you did not have good MCAT scores, can you explain us really briefly what MCAT stands for, the MCAT?
Yeah, I'm not sure what the abbreviations are. I apologize. I would have to go look them up. But it's like the medical assessment exam. It pretty much is like a standardized test that every college student needs to take in order to get into medical school. Nowadays, there's DO schools, there's MD schools, and there's schools in the Caribbean or schools outside the country and other stuff like that. To get into medical school, you do need to get an MCAT score. They recently changed it. I remember my senior year of college, it was the old way. And now they recently changed the new guidelines and what they test. But yeah, I'm sorry. I would have to look up the
medical college admission test. I just found that out. I was doing my live search here.
Yeah.
And you guys, please understand, I didn't go to college or postgrad. I didn't have to take the MCAT to make it into residency program. There is something unique for U.S. Graduates like Dr. Lopez. So we were saying, you said you might have not been the best at your scores on MCAT and other pre-med grades. And you said that sometimes the doors shut down in front of you here in the U.S. Obviously, at that point in time, you still have the dream to become a doctor. What were your thoughts? You thought about the Caribbean, any other international countries, and why Mexico?
So, great question. Again, I explained earlier, nobody in my family knew anything about medicine. I mean, me going to college was like a big deal. We didn't even understand how college worked. We didn't understand how FAFSA worked. We didn't understand how anything worked. So we just had to figure it out along the way. I just knew I had to take an MCAT score. I took my MCAT, got my MCAT back, I remember, and I was just distraught. I was like, this is it. Like, it's over. But no, I remember my mom actually brought up one of the neurologists that she would see, because she has a history of migraines. He actually went to Mexico. And then he told my mom, and he's like, hey, your son should look into this school. Like, I went there. It's pretty good. Like, just check it out. And even that, I didn't even know about like medical schools in the Caribbean. I had no idea those existed. I didn't even know DO schools existed. I had nothing. I thought it was just like U.S. medical schools. So I applied. I didn't get in. And I was like, I knew I wasn't going to get in because of my scores. And I was like, well, it's just worth a shot. Because the worst thing I can do is just apply and I don't get in. Like, I don't lose anything. And that happened and didn't get in. I applied to Mexico, got an interview. And I remember when I got my interview, I started crying. Because I was like, all I need is a shot. That's all I'm asking for. I don't need anything else. Just give me the shot that I know I can prove that I'm worth it. They gave me the interview. I flew down to San Antonio. I interviewed for like an hour and a half. A couple of weeks later, I got an acceptance letter. And then I didn't even think about it. I graduated from Iowa State in May. I flew down to Mexico with just 2 luggage suitcase. So in Mexico, they have these things where you can live with a family, una familia, and then you just rent out a little room. And my room was literally maybe like 7 by 10. It was just enough to fit a little small twin-size bed and a desk. But that's all I had, a twin-size bed, a desk, 2 suitcases. But I made do with it because I'm like, this is my opportunity. That's all I need. And I'm sure there's a lot of us who all we ask for is an opportunity to just show that we can, that we're worth it. Yeah, we might not have the best test scores. We might not be your perfect applicant. You know, I might not have gone to like an Ivy League school. We don't have any family history of like doctors, and my dad knows this one and my aunt knows that one. There's a lot of us, especially from kids from immigrant parents who don't really have that many resources. So again, all I asked was an opportunity, and Mexico gave me that, and I'll always be thankful for that.
I can assume that, Dr. Lopez, you probably didn't consider yourself a wealthy child growing up, and obviously money was not there on your father's behalf to waste, and everything had to be measured. When the decision to get a higher education came along, you went to school in Ames, you had to come with some financial amount of money on student loans to accomplish that. How did you approach any financial barriers, and what was your family's opinion on taking on this huge economical debt?
So I was lucky enough that Ames gave me grants to go to undergrad. They didn't cover all of tuition. And it was a little more expensive too, because it was out-of-state tuition. It was coming from another state. But they were able to give me a little bit of grants for the rest of the tuition and board. Because it's not just tuition. You got to pay room and board. Like, I didn't have the luxury of being able to drive in and out of school. I had to live there. We applied for student loans. And I knew, and my parents were on board. They were like, this is your education. This is why we came. You have to do everything you can to be able to get in. So we didn't even think about it twice. And I knew in the long run, it was an investment in myself. It's a lot of money now, but I know what I can do with it. And I just need the shot. Take the shot, put the money on myself. It's an investment, you know, it's and just how it is. And it was the same thing for medical school, except the loan difference from undergrad to medical school is substantially different. But again, it was an investment in myself that I knew I could do it, and I just needed the shot.
Give me some overall proportions in American dollars, undergrad versus grad, you know?
So I recently started paying my loans now, because the grace period is over. So you have like a 6-month period from the time you graduate medical school to when you need to start paying. And now I was just checking the other day, with the money that I own, I can literally just buy a house. It's like I have a mortgage over my head for a house that I don't even live in. So it's like, but I understand this is how it is. And every other physician has gone through it. And it's scary at first, but I know if I just keep doing what I have to do, I'll eventually get there and everything's going to be okay.
I don't mean to be curious about it, but we're talking more than $250,000 or close to that.
Yes. Yeah.
So I do know that the interest rates are lower than a commercial loan, but still it's quite a difficult payment to do because right now you're a resident. And I think probably the salary in the state of New York for a PGY-1 might be close to 55, or what is it as of now?
It all depends. So I guess it goes by system. Here in New York, you have like Mount Sinai, you have like University of New York, like NYU, you have Northwell, you have Catholic Health Services. So each one of them has their own different system, but it's about 50 to 60. I would say the average is here in New York, but you also have to take into consideration, right, the cost of living in New York, which would be completely different than the cost of living, like, let's say, like in Texas. So it's like, yeah, you're getting paid this much money, but how much do you pay in rent, you know?
Yes. Wow. So you went to Mexico, you got accepted. You went for this interview in San Antonio. Was the interview done in Spanish?
If I remember correctly, it was like a bilingual kind of thing.
Bilingual type.
It was in English, but we also I was able to speak in Spanish. Like I knew that for them, it was maybe a little bit easier to speak in Spanish. So I would just switch back and forth depending on how the conversation was going.
How do you do then once, you said that you came to San Antonio and then headed to Guadalajara? What was it like? Any cultural shock? I know the previous podcast prior to this one, episode number 17 with Dr. to-be Jonathan Rios, he said that the biggest shock was that despite the fact that he felt confident on writing and speaking English, Spanish, going to med school in Spanish was an overwhelming thing to do.
Yeah, and I would agree. And I think it's an experience that maybe not many will do, but it's an experience that we all should experience at some point in our lives, getting out of our comfort zone, because that's where you grow the most. There's a difference. Let's say you're from New York and you fly to California for medical school. The culture is still the same. The language is still the same. The food you can figure out is about the same, right? And if something happens, you can take a quick continental flight back home from LAX to JFK. There's no problem. It's a little different when you go to another country. Going to Mexico, the price is a little bit heavier to fly internationally. Living, like I said, I didn't live in an apartment the first year. I lived in a small 7x10 room, living with another family because I just needed a place to stay. The food is different. I'm Mexican, but I love the food, but I lived in the Midwest my whole life. I miss Midwest food. I miss the culture. I love football and I couldn't watch football because they don't really play football.
Especially having lived in Iowa. Sometimes that's the only thing that there is out there to do, Yeah,
exactly. There was some culture shocks and it was, they could tell from my accent in the beginning that I wasn't from there. So we were lucky enough that Uber was just starting in Mexico at that time. And again, I was a little bit lucky too that it was more of an industrial kind of city in Guadalajara. There are some stores and stuff, but it's still not the same as being home and being in your own comfort zone. But with that being said, I wouldn't change anything because it allowed me to learn more about myself and it allowed me to grow as a person and as a future physician more than I ever would have grown back in the States. So I blessed for that. And again, I'm just thankful for everything.
I know we're going to reach a lot of applicants, specifically in Central Latin America, the Caribbean probably, and South America that are Spanish speakers. They're going to really enjoy this episode because of the passion that you have and the bilingual skills and the few things that you have mentioned. So you're in Mexico. The first year was tough because you were living in this tiny apartment. What was medical school like? Well, how big was your class? What were the hopes and expectations? How did you settle in? What was the most difficult thing to kind of deal with on a regular basis while being there for, you said, the first 2 years, correct?
Yeah, correct. So my medical school, it's UAG for those who are do not really know that much. It's Universidad Autónoma de Guadalajara, and it's they have the main campus out west, and then ICB, El Instituto de Ciencias Biológicas, is where the medical school is. And you have the national program, and then you have the international program. I was in the international program because we were coming from the United States. So our class was about 100, 110 people at the beginning. Half of it was from the United States. The other half was from Puerto Rico, We did have a couple students from like Japan or China, Korea, a couple students from Jamaica, a couple students from Colombia, Venezuela, Ecuador. So we had a pretty good class from everywhere around. And then we were still in the old traditional style of teaching where we learned all of anatomy at once, all of biochemistry at once, all of immunology at once. Because towards the end of my second year, they started switching to the system base where they just learned cardiology, but they learned embryology, anatomy, biochemistry, pathology, all of just cardiology. So we were in the old school teaching. But yes, how you said, the first 2 years were there. The most difficult part was, I guess, the food was one, because even as much as you tried eating, I like going to the gym and lifting weights, but even if it didn't matter how much I did, I wasn't gaining any weight because the diet is different. Also difficult was the amount of work that it takes. They always say how much study you need to put into medical school, but you don't really understand until you do it. And it's all case dependent, correct? So depends how much effort you put into it is how much you're going to get it back. So if you're one of those students who is just like, you know what, I'm just here because I have nothing else to do, you're not going to get that much back. Medicine, I always said, you don't need to be the smartest person. I'm not the smartest person. But what I knew what I was and I knew what I wasn't. I wasn't going to be your brain, and I wasn't going to memorize everything from the book. But what I did know who I was a very dedicated and very disciplined person. I knew that I would have to get up early. I knew that I would just have to go to class, be there early. I tried to sit in the front row. I tried to do everything that I could to learn, audio tape my lectures, take my notes, go back home, redo the lecture, redo the notes, and just study in the library until like midnight and go back home. And I did it every day. But I knew this is what it took because I'm like, I'm not going to memorize the book. You know, it was like, oh, you have like Netter's and you have, Rosen's, like, is it pathology or physiology? I can't remember what it was. And all these other books. I'm like, I'm not going to remember these, but I know what I have to do. And that was also very difficult because I missed a lot of experiences that other people were doing. You know, some people being in Mexico, it's easy to get distracted because you have Puerto Vallarta 4 hours down the road and people are like, oh, let's go like this and go
to the beach.
Yeah. And I can't do that. You know, I got to test. Also, like all my friends, like now we live in the social media world, like Instagram and Snapchat, and I'm in the library at like 10 o'clock at night in my corner, and I see my friends from back in the States who graduated college who are like engineers, and they're making like $80,000-$90,000, and they're traveling the world and doing all these experiences that I didn't have. So missing out on those experiences was also very hard because I'm like, I'm studying here in the library by myself while all my friends are having all these experiences. And I felt that I was missing out in my 20s. Like, is this, and I always had those like things, you know, like, am I doing the right thing? Am I missing? Did I pick the right career? But now looking back and all those sacrifices that you did and all the sacrifices that you didn't realize all paid as dividends. And I'm living out my dream and I couldn't be happier.
For our listeners, he touched on some remarkable mindset issues, you know, dedication, waking up early, doing it all again, repetition, success by performing on, and dedication, and obviously resilience and the mindset that you're going to succeed and that there's something better out there on the other side. Sometimes it's so difficult to wake up and think about failure and think negatively and put yourself down and not to see the positive perspective. I would say that looking at the positive bright side always helped me to get through it, and I think it did. So those are the satisfactions. What would you say that were the lowest moments that potentially made you extremely sad and depressed that you felt that I'm going to give it all up? You just said your friends were having a life and enjoying life in their early 20s and you're stuck behind the books, you know, not being able to date or go out there and have fun and quote unquote get drunk and party like an animal. So
yeah, absolutely. You know, like living in your 20s, you know, that's what everybody talks about. Like, oh, your 20s is the best years of your life. And being stuck in the library, or even when I was in clinical rotations, you know, I wasn't even in Mexico anymore. I did my third year in Phoenix. And even when I was in Phoenix, I would literally wake up every morning, go to clinical rotations, come home, study for CS or CK or whatever it was. And I literally, again, even in the United States, I couldn't even enjoy that. I was like, oh, okay, once I get to clinical rotations, maybe it might be a little bit different. And no, it was still the same thing. And that's something that if you want to go into this field, it's a very rewarding field. And if you really love it, you're going to see it why. but you got to sacrifice a lot. And a lot of times we don't really talk about it. Before you actually start medicine, you think it's this glorified life, and it is, but you got to love it. You really got to love it to enjoy it. And then once you actually enjoy it, and you got to understand that medical school is never over. If you really love the medicine, there's always something new, and you always got to keep reading, and you always got to do your lit searches, and you always got to look at what's the new thing. Because even from when I started residency until now, it's been 6-7 months or whatever, since it was July, and I still listen to podcasts every day. I still listen to what's the new thing, because it is going to change, and you can't become static. So you got to love it. And it's really hard. A lot of people just go into it because they think it's a glorified life. But once you figure out that you really do love it, it's worth it, and you won't ever want to regret it.
Do you think, having had gone to UAG, I know that you had an international program. Did they prepare you a little bit better to sit down for the boards? Because sometimes there is a structure for it, and sometimes there is not. And how much involvement or how much of a role the university played trying to get you organized to sit down for the USMLE?
Yeah, what I've heard about from and I would compare it. What I heard about from my friends who attended medical school here in the United States, their structure in the curriculum for 2 years was designatively made just to pass step 1. The first 2 years is all we care about is you passing step 1. Once you get step 1, then you'll study for step 2, and so on and so on. Once you get to residency, you do your own thing. There's pros and cons, right? I don't think their structure was made necessarily only to pass step 1. So a lot of times you also had to go out of your way and do more than what was required for you to learn and pass step 1. And I think that's the big difference between a lot of people. But what I do appreciate from my school was that they didn't just teach us step 1. They tried teaching us all of it. Even if it wasn't high yield or it wasn't what it was under first aid, our school, they're like, you're going to learn all of it. So looking back, and I just got together with a couple of fellow residents who we were all in the same class. There are one's doing surgery in Hackensack, and the other one's doing internal medicine at Stanford up here in Connecticut. We all got together this weekend. We were talking about it. We were saying how our school, at first we would complain, be like, oh, this is not a step 1. It's not a step 1. But now looking back, it's so much better because we're so much better prepared for medicine as in general than just for step 1. And a lot of times, a lot of people might struggle after step 1 because they were like, okay, well, medical school took my hand for step 1. Now I'm in clinical rotations, and now I'm in residency. Who's taking my hand now? So it was a lot of self-studying too that was involved. But again, you got to want it. It's something that you got to have that mindset that you really got to go for it. And if you do, it will pay dividends.
Absolutely. What's your personal opinion in the change of the USMLE for step 1 for the pass and fail score? And how do you think this will benefit or not us international foreign medical grads?
It's a difficult question, right? Because it hasn't even been piloted yet. I mean, that's what they're saying, but we don't know how it's going to affect. We don't know the statistics. Back in the day, it was easy to say, hey, A equals B, right? If you score well, this is going to differentiate you. But did it really, though? That's my question. I don't know. We actually can do a retrospective study and see how much that these scores tie into where you are now. How do these scores represent the kind of physician you're going to be, which I think is a big important thing that maybe they did look at, maybe they didn't. I don't know. But moving forward, pass-fail, what necessarily means pass-fail, right? There's I think the average a couple years ago was a 217, 220, maybe. I don't know. Now, is that the new line? Is that the pass? If you get higher than a 220, theoretically, did you pass? Did you get less than a 220? Did you fail? Or is that how they're going to do the cutoff? And then again, how much implement are going to put on step 2? Right? Because at least for EM, step 2 is very important. Maybe not so much for radiology or pathology. I mean, I don't know how they grade it on, but I know step 2 is very important in the EM field. So again, it could hurt some people, especially maybe the IMGs and DOs who maybe didn't go to U.S. medical school, MD schools, or maybe it can even out the playing field saying, okay, well, we saw looking back that maybe your step 1 score didn't necessarily say how good of a physician you're going to be. Maybe step 2 did more. Also, a lot of people who score very high on step 1, are they good interpersonally? Can you communicate with patients? Which is a big thing, right? Because if you're working with patients all day and you're one of these people who is very good book smart, but you don't know how to speak to patients that well, does that mean you're a good doctor just because you got a 260 on step 1? It doesn't mean anything, at least to me. I mean, if I was a program director, I'll take somebody who is willing to put in the work and is willing to show me that they want to learn because you can teach medicine. You can't teach these personal skills. So I think that's something that we have to look forward to.
I can tell just by getting to know you right now and the way you express yourself, you probably are well known for having good patient rapport, don't you?
I guess we would have to ask my patients, right?
Go ahead.
I just enjoy having my patients feel well. If they're going to be stuck in the emergency room, nobody wants to be stuck in the emergency room, right? Nobody says it's the best day of my life. So we can make their day a little bit easier, have a conversation, joke around a little bit. It goes a long way.
Yeah. Briefly, I know that you were in Guadalajara for the first 2 years, then you came to America for the last 2 years. You said Phoenix and Houston, if I'm correct.
Exactly. Yes.
Really quick, tell us, why do you guys do the first 2 years there? Why you do the other 2 here? I know it's the international program. And when did you take a step 1 and when did you take a step 2 and how do you prepare to sit down for the steps and what kind of timeline you use and how do you plan ahead?
Okay. Yeah. So how you said, so we did the first 2 years there, and then we have the option to either come to the United States and do a third and fourth year, go to Puerto Rico, do a third and fourth year there, or stay in Mexico and do the third and fourth year there. A lot of people push forward to come to the United States, 1, because you're back in your home country, and 2, because when you are applying to these programs, they want to see that you have clinical experience in the American medical field, right? It could be a little bit different. Even if it's Puerto Rico, it could be a little bit different. And, there can be a little sort of sway and be like, yes, you're used to having the American way. And then Mexico does it a little bit different. So they like these programs, when you do apply, they like to see that you have U.S. clinical experience. I took my step 1 a little bit after second year. We were allowed to start clinical rotations through our school without taking step 1. So I took it in a couple months into year 3. With that being said, do I recommend it? Not necessarily. Try to get step 1 done after second year as much as you can. With that being said, because you're stuck doing clinical rotations, you can't put that off. You have to go every day. Especially if you're in surgery or OB, you get called on the weekends, you're on call, doesn't matter what time, you don't have time to study. So that was a big thing that I had to learn how to balance my clinical experience versus studying for step 1. But if you look at the bright side, it gives you the quality and the way of time management. So now I'm a way better time manager now due to that. But I wouldn't recommend it because it is a lot harder to do. But again, for step 2, you are going to have to do that. It's like you don't have designated time, at least for my school. I don't know how it is for the U.S. grads. For step 2, I would have to go to clinicals and then come back and study at home for hours for step 2. And for that timeline, I guess that's a little bit on it. For resources that I did, I used UWorld more than anything, first aid for step 1, and I used Golgin, pathology review, and I'm not sponsored by Golgin, and I'm not sponsored by first aid or anything of that, but I think that's a big thing that all medical students use. And it was the same thing for step 2. I used UWorld more than anything and first aid. And mastering the boards, I think I used too. And yeah, it's just a lot of hard work. It's really what it is. You got to put in the elbow grease, and just tough it out in hours and questions and questions and questions. I think that's usually what it does.
Did you get amazing letters of recommendation once you were here in America?
So I was lucky that I had great mentors along the way. If you don't mind, I would love to mention.
Yes, please.
So in Phoenix, when I was in Phoenix, my surgical preceptor, he was this old school Indian doctor. His name is Dr. Tahir. I think he's out in Mesa. He's a surgical preceptor, his general surgery, and he pushed me a lot. I originally wanted to go into trauma surgery. That's what I wanted to do. And other students, because he knew what I wanted, and he knew what I could do. So he just pushed me and pushed me and pushed me, and it made me better. I remember at the end, he gave me my evaluation. That was the lowest evaluation I got. And he told me, he's like, I don't give anybody easy scores. It's easy for a preceptor to be like, oh yeah, 100% here, go. And he's like, but I give him honest scores. And he really sat me down. He really told me, he's like, you want to be better? He's like, this is what you got to work on. And I appreciate that, because moving forward, I always look back at that. That was in Phoenix. And then in Houston, I had 2 preceptors who were wonderful. They were both through the ER. One was Dr. Richardson, who I'm always going to be thankful for, and I still keep in contact with her. She's probably one of the most wonderful human beings I've ever met. She's so passionate about what she does, and she really cares about her patients. And the other one was Dr. Ladi, Ladi. He's actually a UAG grad. He's an ER doctor. He's a POM Crit fellow, sleep medicine fellow.
Wow.
So we always had these conversations. If we were like on a night shift together, we had time. He's like, you already took the hard road. Just get used to it. You just got to enjoy the process, put in the work, and we'll do it. And luckily they gave me some letters of recommendations. I never got to see them. I don't know what they put. I remember I interviewed at Cook County
in Chicago.
I think it had been a couple years since they interviewed someone, and they told me the letter of recommendation from Dr. Richardson was superb. She really seems to say something about the kind of person that you are. And I'll give this tidbit to the students rotating through the ER or through anything that they want to go to. Put in the work. The preceptors and the medical student and the other residents and the other staff, they really see it. Don't be overbearing either. You don't want to be shown like you're like on the person the whole time. Know your space, but also don't be lazy. Like ask what you can do more than what's expected. And you don't have to be the smartest. A lot of people think that when you go to medical school, you're like this sort of brainiac and you're the smartest person in the room and all this other stuff. You got to be the hardest working person in the room. And it's okay. I've had people who I really look up to, they told me, you don't have to be the smartest person. And if you get beat, you better get beat by someone who is purely more talented than you are. Don't ever get beat by someone who just outworked you.
Wow.
Because that just means that you just beat yourself. Don't let yourself get beat. Put in the work. But yeah, those preceptors that I had, all of them. And in medical school, it was Dr. Ralde, who was our microbiology professor, Dr. Valdivia, who was our anatomy professor, and Dr. Torres, who was our physiology professor. All these mentors that I had along the way, they really pushed me to believe that I could do it. And I was just lucky enough to have those people to believe in me and help me, because a lot of times you don't have those people and you get discouraged, and you don't have those people to keep pushing you to tell you, hey, it is possible. So I was lucky enough to have that. And if I can do that, and if you can do that, to all the listeners out there, I just want to let them know it is possible. You just got to believe in yourself, and if you believe in yourself, you put in the work, it's going to happen.
You have to put in the work, but you also decided to pick one of the most highly competitive specialties in America to match into emergency medicine.
Yeah.
Why did you do that? Did the healthcare system in Mexico led you to probably practice something that is not as strong as it is in the United States, and why emergency medicine? So
again, right, growing up in a pretty rough neighborhood, you see some things that maybe a 5-year-old shouldn't see with with gunshots and everything else. So that was kind of the environment I saw as a kid, and I wanted to go into the military for that reason, as well as just helping and saving lives. So when I went to medical school, I wanted to be a trauma surgeon. And then once I did my surgical rotation, I realized that wasn't my personality. I don't have that type of personality. And sometimes they say maybe egos go different ways in different specialties. I couldn't stand still on a certain spot for hours. I'm a person that loves to talk to people, loves to move around. The faster things go, the faster I think, the better I think. So emergency medicine was the best way. I scribed 1 year between third and fourth year Phoenix in the ER, and I fell in love with it. It's the love of my life. I absolutely love it. I couldn't pick a better specialty. But in talks about the match, yeah, it's a hard one, right? Because now people go in for the lifestyle. We work shift work, right? We get paid relatively well. We pay
very well.
Yeah, we work shifts, and we are never on call. So it's a good life. And that's why people are now switching from surgery, which used to be back in the 90s and 2000s, are now shifting into the ER life, because you do get to practice medicine, which is wonderful. You don't just cut all day. You practice medicine, you work with patients, and you get to diagnose, and you get to do, it's like what they tell me here, emergency medicine is the Swiss knife of all specialties. You are like the Swiss Army knife, and you have a little bit of everything. Every specialty. You're the best of every specialty. You might not know every single thing to the dot of every specialty, but you're the best at all of them put together, and no one else can do our job. And but yeah, a lot of people do love it now, and a lot of people are going to it. And I think it's probably up there with like anesthesia, maybe plastics or derm. But yeah, it is highly competitive now. And I spoke with you about this earlier. I had people, other preceptors, other guidance counselors that they call it, other residents or other medical students who would tell me along the way, hey, you should not think about ER. That's really competitive. I don't think you're going to make it. You should go into like family or peds or internal medicine. Not that I'm putting them down, but it's for the fact that it's more IMG friendly. You tend to have a higher chance of matching. And when the time for the match came, you have to put your rank list. all these doubts start coming to your mind, and all these whispers start coming in, and you're like, oh, am I picking the right thing? Because it is a game that you have to play sometimes, right? But I had someone tell me, and I always be thankful for her. She told me, she's like, hey, you already went through all this, and you knew what you want to do. Why are you trying to switch now? Just stick with it. That's what you want to do it. And at that moment, all the doubts went away, and I went for EM. Absolutely. And again, I'm just thankful for people along the way that I was lucky enough to have who supported me and told me that I could keep doing it. And I'm out there telling everyone else, if you're an IMG or FMG, doesn't matter what. If you want it, go out there and get it.
It's possible, correct?
Yeah, absolutely. 100%.
It's all about the mindset, dedication. So you just said that you approach the match with certain amount of effort and mindset. How many matches do you go through? Were you lucky enough to match through the first one that you ever submitted your application through?
Yeah. So I applied for the match last September.
Yes.
So what it was, 2018? September 2018. Yeah. And I sent out my application to like 80 places.
Wow.
Yeah, to like
How much money probably you spend there?
Just the application, maybe like $2,000 on just applications. Because then the money goes into interviews, stay, lodging, taxis, Ubers, whatever you have it, airfare. But I just applied anywhere because I'm like, I don't care where I go. I can go to like Timbuktu. I can go to like Bozeman, Montana. I don't care. As long as I get to be an emergency medicine doctor, I'll work. I don't care. But I got lucky enough to get a couple of interviews, and I traveled around the country. And then you got to spend the money on the airfare. You got to spend the money on hotels or Airbnbs now, I guess, Ubers or taxis. You got to spend the money. But again, it's an investment. If you look at it and you're like, oh, I don't want to apply because it's so much money. If you believe in yourself, be like, it's an investment. You got to go with that mindset. You're like, I'm investing myself because at the end of the day, I'm going to be able to do it. I never thought about coming to New York. Well, I had a preceptor in Houston told me he did his residency at Mount Sinai. He's like, if you ever want to practice emergency medicine, he's like, you gotta go to New York, man. I mean, he was just recently out of residency, so he was still in New York mindset. You gotta go to New York. And I was like, sure, I'll give it a try. So I came out here, went to a couple of places. I fell in love with the place I'm at. I love this place. I was lucky enough to match at a residency the first day. It was, I still remember, it was like March 13, 14.
Yes, sir.
Last year. And I remember I just started crying when I saw that said match on like NRMP website on that Monday. It said matched, and I just jumped for joy. And then the curiosity and then the angst and the anxiety come in. I'm like, where did I match?
You don't know until the next Monday, right?
Until that Friday, actually. Yeah.
Oh, yeah.
So beforehand, I was worried. I'm like, if I don't match, I have to go to SOAP, right? So, but then I got through the first step. I'm like, all right, I matched. This is great. I'm excited. I'm happy. And then it sinks in. You're like, oh man, where am I matching? Am I matching in New York? Am I matching in Arizona? Am I matching in Chicago? Am I matching anywhere, right? You're like, oh, what about if this is not the place where I wanted to go? But then you got to put yourself in, it's like beggars can't be choosers. This is what you wanted. Like, where are you going to go? It doesn't matter. But I was lucky enough to get my first choice here in New York, and I couldn't have picked a better place. And I'll say this to the people going for the match either this year or next year. Or I think it's the match is next week, actually.
Yep, correct.
And maybe for next year, it helps a little bit better. If you're going to go in and apply somewhere, and you're going to rank them, go to a place where you're happy. The worst thing you can do is go to a residency and be miserable for 3 to 4 years of your life. And sometimes, the glamour says like, oh, this Ivy League place or oh, this place, like what you thought it was, and maybe it's not. It could be a very malignant program. Go to a place where you're going to learn. Go to a place where you're going to become the doctor that you want to become. Here at Good Sam, we're not a research institute. We're not going to cranking out like papers and all this other stuff. But what we are is we're very good clinically. We're very good at diagnosing patients, managing patients. We're very good at procedures. We get a lot of trauma. So that's the kind of doctor that I wanted to become. I'm not a PhD. I didn't go to get a master's program. I didn't go to get a PhD in research and literature. I'm good with my hands. I'm good clinically. And this is the kind of program that's going to make me even better. So pick a program that tells you kind of look at senior residents and see, am I going to be like that? You look at the senior residents. Are they happy? Do people get along? How do they get along? Do they interact? Because a lot of times you can tell when you go out to these pre-interview dinners, you can tell how well they get along. And if they're just like in cliques and they're not really talking, you're like, this is how it's going to be.
Yep.
I'm lucky enough to all 4 years of us, we get along very well from first years interns to the fourth years. It doesn't matter if they're chiefs and I'm an intern. We all get along. We all get along, and it's great. It's fantastic. And every day I go to work, it feels like I'm hanging out with my friends doing what I love, not like I'm miserable. So I would say that as a tidbit for the people applying next year.
That's golden advice. And how big is your class and how big is your program? How many residents per year?
So they used to get 4, and now we're 8. Now we're 8 because the volume is too much. We get about 90 to 100,000 people a year. And then there's another program like 5 miles on the road, and we still get like 100,000 people a year.
Applicants?
Oh, no, I mean like catch
volume. No, what I was trying to say, how many residents per year? And I don't know if you were talking about the volume of patients per year in your medical center.
I'll touch on both. So volume of patients per year is about 100,000 patients per year. Out of those, maybe like 30,000 of them are pediatric patients. So we do see a bunch of pediatrics and pediatric traumas. We are a pediatric trauma center. We are a trauma center for adults as well. We're like the top stroke center in all of Long Island. So we get to see a variety of everything. Now, as in program, now it's 8 per year. And then, so I think last year or for this match, we had about 900 applicants. We interviewed about 200. And we take like 6 or 8 of them. Wow. I mean, I would have to ask my program director what the bigger number is. But it goes to say now EM, everybody's applying to EM.
Everybody. And they said that 50+% of the workforce are women, right?
Yes. This last year they had 3. This year they had 2. The class that's third year now, that's going to be a 4th year, who are going to be the chiefs now next year, who are the 2 of the 4. But the whole class is all women. You look at them and I'm telling you, man, excuse my language, but they're badass. Like the things that they do, they take complete control of the trauma room. They know exactly what they're doing, and it doesn't matter what gender you are. If you come out of some programs and the things that the doctors can do, and it doesn't matter who they are or what they do. And man, I'm telling you, there's some really good doctors out there.
That's the good thing about training in a city like New York, the exposure, the volume, the independence that they give you to practice, obviously always supervised. But in emergency medicine, you want to go to a program that you can see it all, because you're alone 4 years from now, 3.5 years from now. This is it. You're the man. Deal with it.
Yeah, and I'm really lucky that here at Good Sam, there's no anesthesia residency and there's no surgical residency.
So you manage the airway and everything without fighting for it, huh?
Exactly. So as an intern, we get all the airways. So I think by now I have over 70, 80 airways. So, and I'm only a couple months into residency. All the procedures, it's us, because we don't have a surgical residency. We don't have to fight with surgery, or every other day who comes down for the trauma, it's us. I've done a couple thoracotomies. I've done a couple chest tubes. And as an intern, a lot of times there's a couple other programs who are like 30 years, and he's like, I've never done a chest tube. And because they always have to hand it out to whoever is doing the other service. So it's great, pick a program where you get to practice all this stuff.
Wow. It's been remarkably inspirational. So we've been chatting for more than an hour, Dr. Santiago Lopez. I know throughout this interview, you have given some hardcore golden advice, not only spiritually, but also in the mindset, on the commitment, in the sacrifice, on the dedication. A few more words of advice for anyone that wants to accomplish their dreams of becoming a doctor in the United States and to pick the specialty of their choice?
Sure. Whatever your specialty is, you don't have to figure it out now. A lot of times people think you have to go into medical school, you have to figure it out. You do a little bit of everything, you figure out what you like and what you don't like. Figure out your personality. What kind of person are you? Like me, who loves talking to people and loves going around and moving around? Great. Maybe EM's for you. Are you a kind of person who's more of an introvert and, you like to be alone, and, maybe pathology or radiology is for you? Just figure out what you like and what you're good at. And then for schooling, figure out how to learn and study. Not everybody studies the same way. Don't tell you everybody is the same way. They're not. Now we're lucky to have YouTube or podcast or anything, books. We didn't have that back in the day. Take full advantage of it. Figure out what works for you and what doesn't. And then lastly, don't ever have people tell you you can't do something. Take anybody's words for advice like mine or like alone. So if you really want to do it, you just got to go for it. Don't hear all those haters who are just going to tell you, hey, don't do this, don't do that. A lot of times being scared is what holds you back. And that's going to be the worst. You can be your own worst enemy. There's a quote that I found the other day that I told one of my friends, she sometimes has a hard time, and it's hard being an intern, but it goes by, you're over here doubting yourself while so many people are intimidated by your potential. So don't ever feel like you're less than someone. Don't ever feel like you're not going to make it. Put in the hard work, keep your head up, study as much as you can. The more you read, the more you learn. In medicine, you never stop learning. So if you're tired of doing tests now because you're like, oh, I'm so tired, I'm sorry, but you're going to have tests the whole time. You're going to have to take your boards after residency. You're going to have to recertify. You're going to have to take some CME credit. You're going to have to do these things all the time. And I think I've experienced it into a scholar. And I remember, and it just didn't click, but I heard it one time in undergrad when I was in one of my classes. He told me the point where you just enjoy learning because you just enjoy it, you become a scholar. If you don't, you're just a student. So now I try to read as much as I can and try to learn as much as I can. You're not just studying for your exams, you're studying for your patients. Treat your patients how you want somebody to treat your family members. Do as much as you can. Always go the extra mile for the patients. Advocate for your patients. Because a lot of times doctors won't, especially in the ER, they'll be like in and out times. You're like, oh, discharge, dispo. But sometimes, step up. Even if you're a resident, there's times where you can tell your attending, hey, no, I think we need to do this. Like, I don't feel comfortable doing that. Always feel comfortable in your shell. And travel. If you have the time after medical school, you have that block, travel. Because once residency starts, oh man, you got to work.
That's one of those advice that I give people. Just travel. I don't think anyone can take that away, specifically the experiences of getting exposed to other cultures. Santiago, last question.
Yeah.
Your mom, your dad, your sister, how much of a role they currently play in your social support system? And I know you're single, but how do you keep yourself mentally stable and how do you keep up with your wellness?
As far as my wellness, I try to go to the gym as much as I can. I know sometimes with residency, it gets a little tricky, but I was just currently on EMS in the city. So I got off early sometimes, or on the weekends I was off. So I get to use those days to go to the gym. Again, I'm very lucky to have a group of residents that we all like to hang out with each other. If it's getting dinner or like watching a movie or something, we always hang out. So that always helps, it's separating your mind from just work. As far as my family goes, they've always been supportive of me. They always tell me to do what I think is right, just follow my dreams. And I always have to tell them, I'm like, hey, I owe this all to you. They're like, oh, you should be so proud. You owe this to yourself. I'm like, yeah, but if it wasn't for you guys, specifically my mom and dad, wouldn't have the opportunities that I have here. They sacrifice everything for me, and it's my turn to give something back. And not just to my parents, but to the rest of the Hispanic community, who a lot of times we get put down for where we come from or what we can't achieve. And, I'm just another person that says, hey, we can, and we're here. So,
Yeah, we're here to make a difference. We're here to support each other. So to our listeners, please come on over, send me your messages if you're interested in participating on the podcast. I want people that are willing to share their experience and just give a positive, outgoing message to anyone out there across the world that will be interested in to becoming a successful doctor in the United States. Dr. Lopez, thank you for the last hour and a half of your time, for allowing me to get into your apartment and share your positive and huge, vibrant energy with everyone out there. And as I said, just the best of luck. I'm happy to have a colleague up north that is a Latino like me, that is studying hard and putting in the hours to make us look good every day.
No, thank you for having me. It's the most important thing, right? You're doing a wonderful thing. I don't think it's been done. At least I haven't seen it been done for our demographic. So thank you for that. I'm sure it's going to be a huge success, and this is something wonderful. Thank you for doing that. If you're ever in New York, feel free to shoot me a text and hit me up anytime you're in New York.
I'll be there probably for the U.S. Open if the Corona allows me to go.
The U.S. Open, I think it's in Bethpage. You're not too far from here.
Yes, sir.
Yeah, it's like 30, 40 minutes away. So that's too far. So if you're ever in New York, feel free to hit me up. And
awesome. Fantastic. Thank you so much. And listeners, please follow us on iTunes, Facebook, Instagram, Pinterest. And please remember to download, follow, subscribe. And the YouTube channel is live, episode number 1. More to come. Thank you, everybody. Love you all. Keep listening and show your love and sharing, because sharing is caring. God bless you.